be viruses, there can be bacteria, there can be parasites even. Although public health importance of this attention has been drawn to 8 of them. 8 of them mostly, there are about 30 species of organisms that can cause this, but 8 of them have the most burden that we have, and 4 of which are treatable. The other 4, they are just manageable. So the 4 common ones that are treatable are mostly the bacterial infections, like syphilis, the gonorrhea, chlamydia, and the ones that are untreated or untreatable but manageable includes the HIV that we're all familiar with, the hepatitis B, a human papilloma virus, and a few others.
So, Doc, there was something you said before I asked for a general, explanation or description of what STIs are, and it was that the terminology changed from disease to infection because sometimes symptoms are present, sometimes they are not. What informs this?
Please, can you
What
rephrase?
informs sometimes there being symptoms and sometimes there being not in someone who is already infected? Is it that the infection meets someone who is really healthy? Is it about gender? What is it really about it?
Thank you for clarifying. Yes, there are some factors that can make the progression of some of this infection into manifesting disease. Sometimes it has to do with the person's immune system. Other times it is not. So even in healthy persons, they carry the disease as asymptomatic carriers, and they go on to spread it. And it comes with silent manifestations. For example, most commonly, chlamydia infection. A lot of STI testing do not involve chlamydia testing. So many people get married believing that they are free from any of these infections. Then problem comes when they are trying to conceive, only to get other tests done and then find out that maybe their tube is blocked and whatnot. Most of the time, the culprit is chlamydia. So even if in a healthy person, you can see that there's some sort of manifestation, and then other causes, other infections like the herpes, human papilloma virus, those manifest more in people that have reduced immune system. That's why there is some sort of should I say collaboration now between some of the infections, some potentiating the activity of the other. For example, the synergy between HIV and HPV in the development of cervical cancer, which is number 2 killer of women in Nigeria due to cancer.
Let's start from the ones that are curable.
Okay.
Let's talk about gonorrhea, because for the longest time, I think since I was born, and not since when I was born, but I think I would say from when I became aware of myself and information around me, I've heard about gonorrhea. And I also know that along the line I've heard about a different strain that of the whatever it is that causes gonorrhea that has become resistant. So can we talk about gonorrhea and where we're at with it today?
Okay.
What type of infection is it? What causes it? And then, of course, signs and symptoms of it.
Okay. So gonorrhea is, like you said, very popular and has been with us for long. It is caused by a bacterial infection. Bacteria is named as Neisseria gonorrhea as the name. So it is very, very common and often stigmatized. So one thing that will affect the way where we are with gonorrhea is actually that issue of stigma. So there is underreporting of cases. So we cannot tell exactly, okay, these are the number of people that come up with gonorrhea every year. These are the people that we treat for gonorrhea every year. So the statistics are staggering. But however, we have achieved good cure for gonorrhea. I think it's a very simple infection to treat if caught before the complications, especially for men. because women sometimes they can be asymptomatic, like I mentioned, and then the only manifestation is when they are trying to have children, or when it has progressed to pelvic inflammatory disease, where they have this abdominal pain, discharge, and all that. For men, mostly it's frank. The features are usually frank. There is discharge from the penile area. There is itching. Sometimes the itching within the urethra, the pipe, the
It'll
urine
be
passes
inside.
through. Yes. Sometimes it's even anal itching. Sometimes it's pain while passing urination. For men, it's classically presents as that. So it presents with a lot of discomfort, and most men tend to try local remedies, gargajiya and all sorts, before coming down to the hospital. And like I said, there are complications associated with it. But in women, it can be frank, as per presenting with vaginal discharge, foul-smelling vaginal discharge that is copious, with itching and pain, actually pain during sex. Sometimes even bleeding after sex makes their period worse. Like, some women have painful periods since the first time they started seeing period. But other times, it's later on in life that they develop. And sometimes, most commonly, it's infection that is underlying
That kind of pain.
change, yes.
So are you saying that it's not every man? Because I've always thought once there's pain during urine for a man, that's an STI. So, but from your description now, that means that a man could actually have an STI like gonorrhea and still not have pain during urination, but other symptoms.
Well, that's mostly correct. Yeah, but like I said, sorry, what you said is mostly
That
correct.
pain during urine.
It's more common with men. However, the absence of that pain does not mean
There's no
infection.
gonorrhea.
Yes.
All right, so let's talk about another curable one. Gonorrhea is one of them. Oh, sorry, before we move on, you didn't address the resistant gonorrhea. Is it something that we've seen in our community here in Kaduna? Do you see it during your practice?
Well, most of the patients, it's like I said, there's underreporting, there's underpresenting. But with the few patients that we've encountered with, most of the times they do very well and they get completely healed from the drug of choice that we currently use in practice. So we do not have much reports on the resistant strain.
Okay.
And we've not had much clinical encounter with patients suffering from it.
Okay. So let's move on to the next. Talking about chlamydia. Now, there was also something very interesting you said. You said usually, nowadays people want to get married. They tell you go and have this test, that test, and all of that. So it was interesting for me to hear from you that most STI tests do not include chlamydia. So that means you have to have, you have to ask specifically.
You have to be informed. Yeah. And I think that's one of the importance of what we are doing here.
Yes.
Yeah, people need to become aware. For so long, people are mostly affected by things that cause problem to them. That's why gonorrhea is a superstar in the STI world, because its symptoms are frank and disturbing. You cannot even rest with it. Unlike things that are silent, that you need to know and check. So, yes.
That needs to be done. You need to
You
specifically
need to specifically request,
tell your doctor.
Yes.
Okay.
As if you're just testing just to know.
So what causes chlamydia?
Well,
and what are the signs and or symptoms?
Okay. Chlamydia is clinically a brother of gonorrhea. However, it's caused by a different bacteria. The bacteria is called Chlamydia trachomatis. There are different serotypes, and different serotypes cause different diseases. I don't think there's any need to delve too much into that. But the serotypes that cause these genital tract infections that we have, they present almost the same way as gonorrhea. In fact, if you are treating a patient, the treatment guideline now is, as you are treating for gonorrhea, you are also giving drugs to cover for chlamydia. That's the standard practice. So the symptoms similar, could be asymptomatic. In 75% of cases, they're actually asymptomatic.
Even in men?
Even in men. But men more likely are to have symptoms, because the urethra is more peripheral. It's a long way from the urethra before it gets any further. But in women, the urethra is just about 4 centimeters, and chlamydia gets in the vaginal tract, chlamydia just gets in and finds its way up in the cervix, then ascends as an ascending genital tract infection, causing pelvic inflammatory disease, pyosalpinx, hydrosalpinx, and consequently infertility.
What is pyosalpinx and hydrosalpinx? Please break it down. What is that?
Pardon my French. So pyosalpinx is just basically a condition where the fallopian tubes are blocked, and then because of the inflammation that is caused, inflammation is the reaction of the body to that infection. It will make pus to generate. So that pus being trapped in that tube is what we call pyosalpinx. And sometimes it is not a frank pus, it's like water. And that's what they call hydrosalpinx. They are both an aftermath of tubal blockage. And you know, tubal blockage, the egg needs to pass through the tube to meet with the sperm.
Right.
And that's why it causes infertility. So the features can be asymptomatic or similar to gonorrhea with discharge, itching, and abdominal pain.
If you're just joining us this evening, we're talking sexually transmitted infections. Let's go on this quick commercial break, and when we get back, we'll talk some more with Dr. AWWAL KAMIL AGONO. Stay with us. We'll be right back.
Lokacin jin daɗi sai Kivo Krima.
Idan na sha ko lokacin shan dari sai Kivo.
Na shiga wani shagon kaya tare da yin tozali da abin da nake so, amma sai dai kash da na kalli asusun banki na, jikina ya karaya sakamakon rashin isasshen kuɗi, wanda sai dai kwatsam kafin na bar shagon aka gabatar mini da tsarin na Bill Station Buy Now Pay Later, wani sabon tsari da zaka iya siyan kaya daga bisani ka biya da kaɗan. Tabbas na ji daɗi domin wannan tsari na Bill Station Buy Now Pay Later tsari ne da zai sauƙaƙa wa mai siyarwa da ma mai siya tare da ƙara kawo sabbin abokan cinikayya. Ku yi maza ku sauke manhajar Bill Station a Play Store da ma Apple Store domin cin gajiyar wannan tsari na Bill Station Buy Now Pay Later.
Ziyara ta farko a gidan sirikai na kusan kiran 'yan sanda. Bayan na marmasa dunkulen Mr. Chef sai na ji miyan kuka ta fara turanci. Har ma an ta Amina sarauniyar iyayi ta ce, "A zuba min a kwano in tafi da ita gida."
Ji daɗin ɗanɗanon al'adu tare da dunkule mai sauƙin marmasawa na Mr. Chef Beef mai ɗanɗanon daddawa da kuma haɗaɗɗen kayan ƙamshi. Mr. Chef ɗanɗanon gida, ɗanɗanon al'ada.
John Vance 3-in-1 chocolate. Enjoy instant goodness.
Wato a duk lokacin da muka haɗu a dandalin tattaunawar iyalinmu sai an samu matsala. Abun burgewa ma zan dafa wani abu da duk za su amincewa. Wato da fadukan shinkafa na musamman tare da magi.
An sarrafa magista daga tataccen waken soya, albasa, kayan yajin armashi tare da kanamfari.
Lokacin cin abinci a shiga cikin lallama ko samkar a shigo.
Magista sanya duk abinci da lokacin su kasance na musamman da ba za a iya mantawa ba.
Ina kwana Onion Banana Connect.
Hello 7790. Yawwa, kawata ta ce allura za ta tafi har kwakwalwa ta. Shin ga hakan gaskiya ne?
Honey and Banana Connect.
To ina kasuwa. Sai yar uwar matar makwabcina ta ce matar da ke amfani da maganin tazaran haihuwa mazajen su za su daina son su.
Honey and Banana Connect.
Ni ce kuma goggota ta ce idan na bayar da tazaran haihuwa tsakanin yarana mutane za su yi tunani akwai wata matsala a aure na. Shin gaskiya ne? Honey and Banana Connect na nan don duka tambayoyinku. Kira 7790 a kowane lokaci don tattauna da kwararun kan tazaran haihuwa da lafiyar jami'i. Kyauta ne a asirci kuma babu tsangwama. Kira 7790 ko turo sakon WhatsApp ta 09097133400 a yau.
Honey and Banana Connect ku bi wanda ya san hanya.
When pain knock your door, when headache show in face, M&B paracetamol there for you. Yeah. When pain won't spoil your day, body they pepper you one kind. M&B paracetamol there for you. That's why from school to office, oh, from market to workshop, Ninja people trust them and be paracetamol. You get you why, M&B paracetamol. They summer pain fast, fast. They summer pain fast, fast. You get you why, everybody they use M&B paracetamol. They for you.
M&B paracetamol, the red one. Now for you and your family. Next time pain showing your face, knock them down with M&B paracetamol. It get why. M&B paracetamol go give you quick relief one time.
If your symptoms not clear after 2 days, go see doctor.
Customer don't enter shop. I don't see waiting you like.
Photo.
Body don't sweet am. But wallet he say, Oga, calm down. No wahala. With Bill Station Buy Now Pay Later, customer fit carry product today, pay small later. Business go sell more, customer go smile more. Make you download the Bill Station app for Google Play Store or Apple Store. Bill Station, buy am today, pay am small.
What do we choose? Milk. What makes us strong? Milk. For school, for play, every day. Milk is the way. Choose milk. Choose milk. Choose milk. Healthy body starts with what we choose.
Choose Milk, co-funded by the European Union and the Danish Dairy Board.
Tabdi. Wato a duk lokacin da muka haɗu a dandalin tattaunawar iyalinmu sai an samu matsala. Abun burgewa ma zan dafa wani abu da duk za su amincewa. Wato da fadukan shinkafa na musamman tare da magi.
An sarrafa Magista daga tataccen waken soya, albasa, kayan yajin armashi tare da kanamfari.
Lokacin cin abinci a shiga cikin lallama ko samkar a shigo.
Magista sanya duk abinci da lokacin su kasance na musamman da ba za a iya mantawa ba.
Ku yi tunanin gida inda uwa ke da lokacin karanta wa ɗanta littafi yayin da wani yaron kuma yake wasan gina gida a gefenta. Babu hantara, babu gaggawa, sai zunzurutun soyayya da ta ninku sakamakon samun lokaci. Wannan shine damar da tazarar haihuwa ke bayarwa, wato dama ta gani da sauraro. Kuma a irin wannan yanayi ne yara suke bunƙasa.
Ziyarci cibiyar lafiya mafi kusa domin farawa ko a kira lambar waya 222 wannan sako ne daga ma'aikatar lafiya tare da tallafin gamayyar kungiyoyin Pronet da FEM.
Iyali uba 'ya'ya da ma'uwa.
John Vance 3-in-1 chocolate. Enjoy instant goodness.
Mama and Papa, na pikin fit be the next big star. Imperial National Online Competition Kiddies Edition 2026 it don land. Registration nko na free of charge. Your pikin go fit to win the grand prize of 2 million naira akpalakpala ewelelelele plus all expenses wey be say dem go pay for you and your family for Abuja for 3 days. First runner up nko, e go carry 1 million naira igbim. Second runner up, e go waka with the 500,000 naira idindin. To register nko, you go send your pikin a picture, full name and email through WhatsApp to 081-623-23504, or you fit to visit us on top of www.17dayempire.com. You go register your account, then you go message us on top WhatsApp to take a complete the registration. No dull yourself. Give your children the chance to take a shine. Make them forfeit to make you proud. Imperial National Online Competition Kiddies Edition 2026. Let small dreams they become big success. For more information, you fit to send us message on top WhatsApp for 081-623-23504. Imperial National Online Competition Kiddies Edition 2026. Now place where we say small dreams they become big success.
With total submission to the will of the Almighty God, the family of Kaza Alamagani Raku, the entire J, Zonkwa District, and the Budget Traditional Council solemnly announced the passing of their beloved husband, father, son, brother, uncle, grandfather, friend, and distinguished traditional ruler, His Highness Honorable Andrew Chechet Kaza Alamagani, Wambai Baju, and District Head of Zonkwa, who peacefully answered the Master's call at the age of 81. The family invites relatives, friends, associates, and the general public to join them in celebrating a life of honor, service, and enduring legacy. Burial arrangements are as follows: Monday 27th, Tuesday 28th, and Wednesday 29th July 2026. Cultural and traditional dance displays will hold at the Kaza family compound, Fadia Bokut, Zonkwa. Time 5 p.m. daily. Thursday 30th July 2026. The body departs St. Gerald's Catholic Hospital, Kakuri, Kaduna for St. Louis Hospital, Zonkwa by 8 a.m. Wake would hold same day by 3 p.m. as the family compound of Agwam Andrew Raku Kaza Alamagani, popularly known as Andrew Angban, in Fadia Bokut, Zonkwa. Friday 31st July 2026. Funeral mass will take place at St. Michael's Catholic Church, Fadia Bokut, Zonkwa, Kaduna State by 10 a.m., followed by the final interment at the family compound. Reception follows immediately after. Join us as we celebrate the remarkable life and cherished legacy of His Highness Honorable Andrew Chechet Kaza Alamagani, Wambai Baju, and District Head of Zonkwa. May his gentle soul rest in perfect peace. Amen. Announcer, family.
All right, welcome back from that commercial timeout. Still on the program, Your Health 360, right here on Invicta 98.9 FM. And with me in the studio is Dr. AWWAL KAMIL AGONO, and we're talking sexually transmitted infections. Before we went on that break, he had broken down, tried to explain to us what causes gonorrhea and chlamydia. And these two fall under the treatable or curable infections, if you like treatable, if you like curable, but you were able to do away with them completely. Now, Doc, while we were talking, you had mentioned some others that fall under the treatable ones that we have in Nigeria. What other ones haven't we talked about?
Okay, we haven't talked about syphilis.
Okay.
And we haven't talked about trichomoniasis.
Okay, so go ahead. What causes syphilis?
Syphilis is also caused by a bacteria, Treponema pallidum. Although, because of heightened awareness and, should I say, strict antenatal care programs, the incidence of syphilis has drastically reduced. Yes. And syphilis is actually a very notorious infection. It comes in stages. The earliest stage can present with a simple ulcer, painless ulcer, whether in the private part most commonly or other places. This is when it's affecting adults, I'm saying. So after that, even without doing anything, the ulcer heals, and then a person has the illusion that he's well and treated or cured from the condition. It takes about another 6 weeks later or some time later, they present with generalized body rash that doesn't spare any part of their body, including the palms and the soles. And this rash can be very disturbing, and most of the time, it's what brings patients to the hospital. It takes another while before those rashes fade up, even without intervention. And then there comes a stage where there is no symptom at all